Hello, this is Dr. Do again. This video is alphabetic list of problems, still on letter O. And today I'm going to talk about osteoporosis, which is quite common. I think I had a previous video in the female care. I talked about age, different age of female, and mention about this osteoporosis. But I'm going to just talk about the osteoporosis today. Let me just bring up the first most important thing of this osteoporosis, and is there any emergency situation associated with this osteoporosis? It's quite discouraging actually. In real life there are a lot of undiagnosed osteoporosis, and particularly for older female, postmenopausal, and lean body mass index up to the falling or bumping somewhere, and with this persistent pain. So if that's the case, I think may indicate the fracture or damage to the bone, because this osteoporosis really increases the risk for the fractures. So if that's the case, regardless the location, regardless whether there's any other symptoms, get it checked and make sure there's no fracture, and also may really diagnose the osteoporosis and start to treat to build the strength of the bone. So talk about this emergency situation. Let me just talk about at the other end. Can you manage this at home? First of all, the supplement from over-the-counter, there are some, either calcium or vitamin D or any other estrogen supplement you can take. However, for the older people, particularly for those with systemic diseases and take many other medications, so I encourage you to discuss with your physician before you take any supplement, to make sure there's no side effect, there's no interactions between the supplement and the medication you're taking. So having said that, let me just talk about the bone structure. We all know the osteoporosis, actually the osteo means bone, porosis means the holes, like the space is getting large, so which means the bone getting loose. So that's because of losing of calcium. So the bone has two components, actually very important components. Is inorganic, which are the calcium. The majority of the inorganic component is the calcium, and some organic component like the fibers, the collagens, and the proteins. So with this loss of calcium, then the bone density start to decrease. So that's one of the mechanism of osteoporosis. And in terms of the why majority tend to occur in the postmenopausal woman because of the estrogen decrease. Why decrease estrogen to cause this osteoporosis? Because in the bone is a really interesting structure. It's always undergoing remodeling lifelong by different type of bone cells, osteoclast, osteoblast. So one is to melt, it's like to chip off those not following the mechanical force. Those structure was absorbed by the osteoclast cells, and the other is osteoblast, which means to add more calcium and protein to make it grow. So this is the ongoing process, and the function of estrogen is to increase the activity of the osteoblast, which means to increase the bone rebuilding and the strength. And also estrogen can inhibit the osteoclast, which means to melt down the bone. So this I use the common language, not the medical language. So when postmenopausal woman estrogen decrease, so this osteoclast function start to increase, so absorb the bone. At the same time, osteoblast, which are forming the bone, the function of these cells are decreased. So to end, you do not have the cells to build up, and also the activity of the cells to absorb the bone to melt it down, increase. So that's the risk factors why the postmenopausal woman had risk factors of this osteoporosis. However, it's not occurring in anybody, and it's just the risk factors for those low body mass index, because the vitamin D can really has to be what vitamin D is a lipid of vitamins. So low body mass, low fat component, really this is an advantage for the cardiovascular, but for the bone is a disadvantage, particularly in the Caucasian and also Asian female postmenopausal. So for those people, when you get to that age, you probably need to regularly, preventively, to see your physician to check, to get a baseline bone scan, and then after that keep following. And there's a number, so this is 2.5, you probably know the T-scores and the G-scores, and 2.5, but it doesn't matter, it's just that's the job for your physician to determine whether you do have it or do not have it, or whether you have risk or not have risk. But for you as a patient, just go to check it and keep this in mind. If you're really skinny, lean person, so just keep this in mind, and also follow the advice from the physician to take some medications. Biphosphate, for example, is really can build the strength of the bone. Or if you're willing, or if you wanted to take the over-counter supplement, discuss with your physician so you can take some to increase the strength of bone. And also at the same time, for those older people, I take this opportunity to say, when you rise up, when you walk, just try to slow and watch the floor. If it's slippery, then just do not walk too fast. So decrease the risk of the fall. So that's decrease the risk of fracture. Particularly for female, the fracture of the pelvic bones is one of the risk. Actually high risk area to be broken actually after the fall, because of the structure. And also the pelvic fracture is quite dangerous. It's probably one of the most serious bone fracture, because of a lot of, in addition to the important organs, also a lot of large blood vessels. So if the fracture on this pelvic bone may increase the risk of heavy bleeding, hemorrhage, serious hemorrhage. I think nowadays, because of imaging study, because of the preventive service, is not the death by this pelvic fracture is greatly lowered, but probably a couple of decades ago, it's high mortality rate for this pelvic fracture. So anyway, so this video is about osteoporosis. I just briefly explain to you why the estrogen is so important, and also there's some supplement you can take, but before you take those supplements, talk to your physician, particularly for those have chronic diseases and taking many medications. So I'm just going to stop here, and hope it helps, and I'm going to see you next time. Thank you for watching.